new COVID admissions, they entered their daily hospital census. So that really threw things off, and there was no way for the state to see that data. So we worked together as a region, the South Central region, because none of it really made any sense, to find that out, and then we pushed that to the states, and then they had to look at it. So that's how that worked. We are going to take a little more responsibility as a region to keep an eye on our data ourselves, so that hopefully doesn't happen again. We had to meet 3 criteria to move into phase 2. The only criteria that we were not meeting was our percent positive, and we'll talk a little bit about Kittitas County numbers there. But when we were the only region that did not move into phase 2, there was lots and lots of pressure on the governor's office from lots of different people about moving Kittitas County out of the South Central region. That is not going to happen. That would be, I think, despite having our elected officials, both locally and statewide, and national officials pushing on the governor's office, that's just not going to happen. So we have to work with our region. It's going to be really important as we talk about vaccine and the other things that we're doing to make sure that we're also keeping track of what's happening in the region. So that's what happened with phase 2. Our local numbers are really going down nicely, although if you just look at our incident rate, if you remember, they were around 600 cases per 100,000 for 14 days back in December. We've kind of leveled off at, from February 8th to the 16th in the low 100s, 116 to up to 133, and then back down to 112. So that's not what the state has on their dashboard. That's just what we know is happening here locally. Our percent positive in Kittitas County is now down to 4.5%. To meet the criteria for the phases, that had to be less than 10%, and the goal of that is to be less than 2%. So we're still far from where we want to be, but we are moving in the right direction. We currently have 13.75% of people in Kittitas County that have started being vaccinated, and we have 3.24% totally vaccinated. In comparison to the state, is 10.7% for the state initiating vaccination, and about the same, 3.25% for the state for people fully vaccinated. So the data is going the right direction, which is reassuring, but it's still high. And what we have that's kind of a unknown player in this whole thing is the B117 variant that started in the United Kingdom. That's the potential game changer in all of this. We currently, as of yesterday, have 25 cases in Washington State. That's not a random sample. So the way those are found, at least so far, is that there's a way to look at a protein called the S protein that's a dropout. So when they do the testing, they look at 3 separate proteins. They're still testing positive. It's just one of those 3, the S protein, is not showing up as positive. So they're testing those. So that's not a random sample. That's definitely a specific sample. So we know we have a lot more than 25 cases in Washington. The state is really looking at gearing up on the number of those that are being tested. We know that that's much more contagious, and There's some data coming out of the United Kingdom now that it may actually be more virulent or more dangerous, causing more severe disease. In regards to vaccine, we're at about 38% of the people that in Kittitas County that are older than 65 or are older than 50 in multi-generational households. So we are having difficulty reaching those groups, and we're trying to figure out how to better reach those groups. We're reaching out to Apoyo today to try to reach the Hispanic population that would fit into that. We are still stuck in the phases for vaccination, so we're still in B1. We are planning on keeping all our vaccine here, because if we say we've met, we're not able to fill this, and we transfer that vaccine out for, let's say, to Yakima, then the next vaccine doses that we get will be decreased by that amount. So we don't really want to give up vaccine that we have, but we are reaching out to people that are in this older than 65 or multi-generational households. What's happening at the vaccination clinic currently is that if somebody doesn't show up, or when they start realizing how many extra vaccine doses they're getting out of vials, they start calling people that are on the wait list for those people that meet B1 criteria. It's not, sometimes we can't get a hold of those people. So you might find that they call somebody else that they know. I know a few teachers got called yesterday, for example, and got vaccinated that would not be considered in those categories. So they are doing their best to reach out to people. We still have not wasted one dose. With the Pfizer vaccine, it's definitely time limited. So it's not like we can call somebody that is 72 and lives in Cle Elum, because they can't really get here in time to before that vaccine expires. So as soon as it's taken out of the freezer, the time frame starts to click. So more in regards to vaccine, actually I got it from 3 separate school superintendents. The state is trying multiple ways to figure out how to get teachers vaccinated. So as you all know, that there's the OSPI Kaiser group. There's a project manager that reached out to all the school districts saying, tell us how many teachers you have, how many staff you have, how many people older than 50, how many people that you have that have health problems. That's just another way to figure out how to get vaccine into teachers' arms. In our county, and we'll talk about this at the superintendent meeting today, that our plan is still to vaccinate teachers at school using nursing staff from Kittitas County when teachers are able to be vaccinated. So that, I can't really tell you when that's going to happen, because it really depends on when the state allows us to move out of B1. There's a lot of push from a lot of people that are in smaller counties like ours saying, we're ready to move forward. And there's a lot of pushback from the larger counties. I'm just going to throw King County under the bus, for example, because they're only at about 20% of their B1 group. So there's a lot of push and pull going through the state. But Tristan Lamb and I were just talking about this morning. I mean, we are under the gun from the state saying you can't step outside the current guidelines. So we are not doing that yet. The time for vaccine availability for everyone keeps getting pushed back a little bit. Dr. Fauci had said late March, April, and then it got a little later, and then President Biden said late July, August for the general population. I think he doesn't want to overpromise, so I think that's where that comes from. But we're still waiting for Johnson & Johnson vaccine to have the FDA continue to look at that data. and that's on the 25th of February that they're done looking at that data. Then they have 2 weeks to make a decision. So that's where we're at in regards to vaccine. In regards to the outbreaks and testing, so we do have a AAU U14, U16 girls basketball outbreak that it was involved with games that occurred in Brewster on the day before Super Bowl Sunday, so on Saturday the 6th. And then that particular group also got together for Super Bowl Sunday, and also are traveling, trying to keep mental health up, traveling together to go skiing up in at Snoqualmie. So they had lots of exposure. We have 12 students, parents, and coaches from Upper County that were positive in regards to that basketball tournament that happened. And we know that we at least have 2 other students that were in Brewster that were from other counties. We do have some lower county AAU teams that were involved in that too, but nobody that was positive. So what's happening with those is that they're working at trying to keep mental health going, but they're also not following the same guidelines that, for example, high school volleyball players have to follow in regards to masking and social distancing and the like. So we are still working out protocols for testing. We have plenty of both rapid antigen tests and mail-in PCR tests, which some of you have done. We did that with some of the teachers for the kids that had mask waivers early. And so we're working out protocols for that. Considering, I know that Cle-Elum-Roslin is considering mandatory testing for athletes. I know that there's some questions about how that's pushing on some legal buttons there, but we'll be talking about that on the school superintendent's meeting here. And I've also requested a meeting with the athletic directors to talk about testing. It's really, and it's the same thing we saw at the college, it's really not what's happening on the court. It's really what's happening outside. It's what's happening when so going back to Super Bowl, one of those folks were already symptomatic at Super Bowl Sunday, but they still went ahead and went to a Super Bowl party. And that's what we see at the college too. We're not seeing transmission on the basketball court. We're seeing transmission occurring when people are getting together to watch TV and play video games and eat tacos and those kind of things. So in Cle-Elum, thinking about this, and this is thinking about transmission in schools. So we had a teacher and a basketball player that were in a specific class, and we also had a basketball player that was practicing indoor soccer with the schools during the time frame that they were contagious. So we went ahead and tested, Cle-Elum-Roslin School District nurses went ahead and tested the whole class that had the teacher and the student that were positive, and they tested the whole soccer team. There were no positives in that group. So it was all really related to transmission outside of school, which is what's reassuring in regards to this whole thing. It's what we've seen all along, is the transmission's not occurring when people are watching what we're doing. The transmission is occurring when people aren't watching. So so that's where we're at with that. The other things that I'm doing is trying to align guidance. So we had difficulty with, for example, mask wearing in cross-country athletes. The guidance from the state for college didn't really align with the WIAA guidance for high school athletics, which didn't align with if you and I would decide to run a 10K. So we did align those things. There's some things that I can do. I'm working with the folks that are putting on the winter musical to try to align some of the guidance, because the guidance for outdoor theater is not the same as the guidance for theaters in school. So there's some things that I can do within the confines of the guidance, but pushing on things, pushing on the governor is less effective if there's not some disconnect between the guidance. So that's where we're at there. Questions. Been some recent misinformation on getting on a list for a vaccine. I've heard that there's a sign up genius for teachers or wait list. So the you can go to the public health website. You can sign up. It does not allow you to make an appointment until your phase is available. So for teachers, for example, that sign up list would be once we go to the B1, which is for teachers older than 50. But there is a way that you can actually sign up, and that's where they're going to try to reach people to fill the positions that are available. And I'll clarify that with Mandy Olson when I go over there today. But there's ways to sign up, but you can't really sign up for you can put your name on a waiting list, and there's a lot of people on a waiting list, but they're not, there's not a magic list they're really trying to get those people that are older than 65. Kind of the same question from Kelly. Yes, by phase finder, Kelly, if you're a teacher, it doesn't matter unless you're older than 65, if you use phase finder, you're not eligible. So, but I will, when we get off this phone call, see if I can sign up on the Sign Up Genius as under 65, which currently I'm 64. I wouldn't qualify except I'm a healthcare provider. So I'll try that, and I'll let Ginger know at our 1 o'clock meeting. Sports protocols. So the sports issues are pretty well lined up in the phase guidance in regards to what can actually be done. For example, can't have more than 200 people there, including it for outdoor sports, including including spectators. So it's going to be tricky for soccer, for example, that those people that are hanging on the outside of the fence watching people play soccer, those people are counted as spectators. So we're going to try to talk to parents in regards to making sure that we're staying within those guidelines, because the reason for keeping those numbers low is to reduce transmission, and we really should be allowing the kids to play. The masking guidance may change. Get lots of questions about masking guidance for football, for example. The only masking guidance that really changed first off was for cross country and for some gymnastics, but I think we're going to get some guidance changes that occurred for track, for example. We're probably not going to get mask guidance that goes away for football players, for example. Along with mask guidance, as you all know, the CDC has said, we should all be wearing better masks. That's really good data. It's not you have to wear a better mask. So LNI hasn't stepped into that and said we have to be wearing better masks, but we know, and I don't have one of the ones that you can tie, but we know that if you wear a surgical mask and you put a cloth mask onto it, which makes it fit better, you have less transmission. The state's looking at that, how they're going to apply that, and we'll follow the state guidance. But certainly it makes sense that the better masks that we wear, the less transmission there will be. It'll really be important if we end up having a lot of B117 Yeah, lots of questions about Sign Up Genius, and I'll clarify that because I have not gone on Sign Up Genius recently, and I've not really been involved with that piece of it. Masking and social distancing. Let's talk about that a little bit. So until we get to herd immunity, there will still be some restrictions on masking and social distancing. So we need to have enough people that either have gotten the disease or are vaccinated from the disease to make it so the population of people that are choosing not to get vaccinated or perhaps can't get vaccinated because they're 12 years old and we don't have vaccine for those kids currently, that the virus doesn't have enough of a population to infect. So I don't think that we will have any, until we know what's happening with the B.1.1.7 variant, I would not expect any regulations to be made less strict. So for example, the 6-foot social distancing, even though the CDC guidance says, well, if you can't meet 6 feet, you might be able to do 3 to 4 feet. I can tell you that's not going to happen in Washington State because the governor is really, really concerned about COVID-19, and that would have to come from the governor's office and from OSPI. OSPI and the governor's office still says 6 feet is how far away we should be. Now, obviously, we can cross by each other in the hallway. We may not be 6 feet there, but we can't really put desks closer than 6 feet, which limits the number of kids that you can have in class. That's really the limiting factor, and I don't think we're gonna get there anytime soon. We're working really hard on people. So, and going back, we've only reached 38% of the population older than 65. I mean, that's the most accurate data we can find in Kittitas County so far. Well, those are the people that are at the highest risk for serious disease. So I'm not sure when we're going to get, when we are going to get to herd immunity, which are some of the other questions here. But I don't think anything is going to change. So the governor didn't mention phase 3, so I got onto the call very late because I was on another call. And at the very end, one of the newspapers asked the governor about phase 3. And that was the first time I can remember him mentioning phase 3. And he said, we just got into phase 2. We haven't really looked at it yet. But there has to be a phase 3. We can't go from phase 2, which has all these restrictions, to being totally open. But those things are not going to change until we know what's happening with the B.1.1.7 variant and the other variants that are in the United States currently. The other thing that nobody's asked about, but everybody wants to know, which is about the 14-day travel quarantine. So they are working. So that came up yesterday as well with the governor's office, not on that call, but we are currently, we look at people who've had COVID-19 as having 90 days immunity from having to be quarantined if they get exposed to somebody with COVID-19. We also are applying that same rule to people that are fully vaccinated for COVID-19. So as we move into, it may be that, and I think what's going to happen on the governor's level is that they're going to say if people have been fully vaccinated for COVID-19, they're going to take away that you have to be quarantined for 14 days. But I know the governor's talking about that because it was brought up yesterday, but currently the governor's recommendation is still for a 14-day quarantine. And that's to keep people from going out of state. Those AAU teams, I have to say that the AAU teams in Cle Elum, the coaches were amazing. They had already called all the parents that were not going to Idaho, but they were all going to Idaho last weekend. So if people are still traveling, people are still bringing disease back, and that's what the governor is concerned about. Is herd immunity based upon the whole county or just the Ellensburg school district boundaries? Central has asked that same question too, because they still have not decided, but they are still talking about making COVID-19 vaccine mandatory for students coming to Central. They have a vaccine policy already in place that mandates some vaccines. If they choose to do that, they're the only college in Washington State that's moving that direction. But if they choose to fully vaccinate their student population that's taking in-person classes, then they're planning on having full dorms and full class sizes in the fall. We'll see how that works, but that's their plan going forward. Other questions today? As soon as I know anything about teachers being vaccinated, Ginger will be the first person to know.
I'll send that out to everybody like that.
And I will find out on the Sign Up Genius I'll go step out and talk to Tristan, and I'll send Ginger a text message. I'll also try to sign up on Sign Up Genius.
Dr. Larson, I just have one clarification. My understanding with the 14-day quarantine with the travel is the governor is still saying it's a should, it's a recommendation, except for if somebody travels to, obviously to South Africa or Britain, right? That it would be a requirement of a 14-day because of the variant situation.
That's correct. Those are
Okay.
mandatory. Those are mandatory quarantines for people that are coming from areas where there's variant disease. So, and you know, that's those people actually end up getting contacted when they get off the plane.
Wow.
So we know those are not people coming from Mexico, although I suppose you could go from Brazil to Mexico and then come in from Mexico. But if you're flying back from Brazil, you are being notified by the FAA and the CDC, and then we get notified of that. So that's similar to what we had with Ebola when the Ebola outbreak was happening in West Africa a few years ago. We were getting called with people that came back from West Africa, and those people were quarantined here in the county.
So you would also be contacting them because you would know about them, right?
It then comes to us to get people quarantined. So next shipment of shots. So this week we are doing mostly second shots, according to Anna Scarlett, who's the vaccine ordering person. We did meet with Fred Meyer. We met with all the pharmacies. The only ones that weren't on that call yesterday was Safeway, but they are still within the same categories that we are. That we do not have any first doses coming in next week yet, as far as I know. And so the state is really trying to even things out in regards to the number of people that are vaccinated. It just unfortunately puts those of us that are perhaps a little ahead of the game on hold, and because they don't want to give it to us and then have us say, okay, well, it'd be good for all of you, because we'd say, well, okay, well, we have too much vaccine. We don't want to get rid of it, so we're going to give it to teachers in B1. Well, then we wouldn't get any vaccine after that again. So if we got more vaccine, we'd have to be deciding. What we would probably decide is to, other than reaching out to people in B1, which is this afternoon, I'm going up to Apoyo to talk to Phil Garrison. And we've got Spanish speakers that are going to be working at the fairgrounds tomorrow to sign people up in those categories in that population. But otherwise, we have to reach out to Yakima and say, you know, we have this vaccine, you can come up here to do that. And we don't want to send that vaccine to Yakima because that decreases our numbers the next time. So 70% herd immunity is really county-wide, right? So I mean there are pockets, but the more people we can get vaccinated, the better. And it's gonna be difficult. I'm a little disappointed that we're only at 38% in the older than 65. I called the managers of all of our clinics this morning and said, can you get somebody on the phone and start talking to your patients that are older than 65? So we're going to try to reach those people so we can move on to the next group. Well, yes, CWU students would count in our 70%, and it would be great if they mandated vaccination because those would increase our numbers. And it actually would be really good for the county. You know, the students have been a big they're a big part of the county on lots of levels, economically, socially, but they're also been a big part of the county in regards to disease. And so, yeah, it would help to have those people vaccinated.
And somebody had earlier, Dr. Larson and I meet with the leaders from the city every Friday morning, and I've already put out there, and I know you have too, Dr. Larson, that we, especially when we get more vaccine in, we want to go all out and really encourage people to get their vaccinations in order for us to be able to open schools for in-person 5 days a week. And you'll notice I put that in my sentence in my soup update, and we're gonna start putting out there more and more, especially once the vaccine is here. So we are working together with the city and the county commissioners on how do we do a whole Kittitas County encouragement around vaccination.
Yeah, so, you know, whatever, I think we can find, you know, people are going to have some concerns about vaccine. I mean, there's always going to be some concerns about vaccine, but there are going to be 10 people in the county that would say, I'm willing to get a vaccine so my favorite restaurant could be more open. There might be 30 people in the county that says, I'm willing to get my vaccine because I want schools to be open. So, and even though they might not normally get a vaccine. So we just have to start grabbing those 5, 10, 15 people that we can as we move along. So, when can kids go without masks? So that was the question again. The kids can go without masks when the state says kids can go without masks and on recess, and it's unlikely for that to happen until we know what's happening with B117 variant, which we won't Michael Osterholm, who's the head of the Center for Infectious Disease Research and Policy at the University of Minnesota, he thinks it's going to be terrible at the end of March. And, you know, he's pushing really hard for changing the vaccine schedule to not give the second dose. So there's a lot of people that are saying, you know, it's important for us to give the first dose and get it in people's arms so we can reduce the chance of having a problem with the B117 variant. He actually gave up he was supposed to get his second shot tomorrow, and he gave that up to an older person who's older than 65. So there's a lot of concern about that. So about B117 variants and a lot of very smart people. And so I don't think that they're going to back off on things like masking outdoors, and certainly not the 6-foot social distancing until we know what's going to happen with that. If it turns out that our numbers keep coming down, then, and we don't have a flare with that, then I would see that start to happen. And I think the other piece that might impact that, if we can vaccinate teachers, then that population that would be at risk for disease transmission on the playground from their kids, then they might be willing to decrease that requirement for for masking. But right now, I don't really see that that's going to change anytime soon.
All right.
Yes, 70% includes all age groups. Sue brings up an interesting point. We don't really have vaccine available for those people under 16 years of age yet. They're looking at that. You know, the other thing that's right around the corner is agricultural workers, and where do they fit in, and how do we get, because they affect, well, mostly they affect the whole central Washington, right? All the way from Walla Walla all the way up to Okanagan, because those folks who provide a great amount of our food move straight north, and then they come straight back south again, they go back north again. So they're currently coming through and trimming apple trees. So that group is already here. They've been testing. There's a group called Medical Teams International have been testing in, not vaccinating, but testing for COVID-19. And those, we've not had a whole lot of positives yet in that group. There was another question about our students that are coming back. So are students that are coming back getting tested for COVID-19? And the answer is yes. We're still prioritizing, at Public Health, we are prioritizing K through 12 contact tracing and testing. So we chose in Kittitas County to follow CDC guidance from the instead of being 14-day quarantine, we gave people the option of doing 7 days plus a test. And because people weren't staying in quarantine for 14 days, and the people that are coming back to school that should be in quarantine, students, they are getting a test before they come back at 7 days. So that's happening, and that's really helping a lot. If we have, like I said, we have plenty of tests. I mean, if we could convince people, parents and staff, to test twice weekly, test everyone twice weekly, that would be optimal, because the rapid antigen tests capture people right on the upswing of when they're infectious. You know, people have lots of reasons that they don't want to do that, some which are good and some which are not good, but we're not at that point of mandating vaccine, or mandating testing, but we have plenty of tests available, plenty. What we have to make sure that we do is that we have plenty of staff. So if we choose to have all athletes tested, for example, who's going to do that testing? It's not rocket science, but it does require manpower and time. So we have to work on that. And I will get those. I'll get the answers on the Sign Up Genius to Ginger by 1 o'clock.
All right, I don't see any other questions, and I know we have another PD to go to, many of us. So thank you, Dr. Larson, and I know I'll circle back with you at 1, and thank you, everybody. Have a great afternoon.